Y estamos en directo. Entonces, we're live. Sorry, I'm talking in Spanish. Sorry, folks. Hello, Galaxy. Welcome to our live stream and thank you for joining us. I'm Lilia of Facialteam, and I typically use feminine pronouns, which brings me to a very important point. We hope that this platform serves the patient community and gives voice to your concerns. So please ask us questions in the chat. Although our lives have featured speakers of diverse gender identities in the past, we regret that this month is not the case, although it is crucial for trans and non-binary voices to not only be included, but also to have equal opportunities to lead all TGNB related conversations. So please let me know if you want to join us in the future. Today, we are going to talk from our own professional experience about the conservative versus aggressive debate as it applies to FFS, facial feminization surgery. So here to give expert opinion, we have two of our best. Dr. Daniel Simon, FFS surgeon, co-founder and co-director of Facialteam. Welcome back.
Thank you, Lilia. It's good to be back.
And Mayte Mateo, who is our Facialteam psychologist since the autumn of 2021, also in Marbella, Spain. Welcome, Mayte.
Hello, everybody.
So tell me, both of you, what's the routine today in Marbella? How are things going, Dr. Simon?
Well, we are having a busy week as usual. We are today in the middle of the week, so it's a Wednesday. We have had two surgeries, two patients, and there's one patient already still in surgery right now. She's doing a rhinoplasty with Dr. Bedinga, and we are looking forward to the holidays, to be honest. So we want the summer to come fast. We are waiting for that because we have had a very, very busy year. Very nice.
Thank you.
And Mayte, how is your week, Mayte?
Well, I agree with your opinion. I mean, it's been a busy week, right? Today, what I have been doing is, meeting patients for the very first time in person in their pre-op consultation. Also visiting patients at the hospital the day before their surgery. And I was supposed to have a patient meeting today, but finally, patients were not joining. So yeah, I didn't have it today, but on Wednesdays I usually have it.
Well, thank you so much, both of you, for taking time out of your very busy schedules with surgeries, consultations, clinical sessions, private and group sessions, preoperative meetings, etc. So we're going to jump into the content now. People are dying to hear us talk about this. So now let's try to deconstruct the aggressive FFS concept. Dr. Simon, do you think aggressive is necessarily better?
So you said, Lida, you are thanking me to give time for this, but I was really looking forward to talk about this subject. We have been working on this subject for a long time here because it has been a very common debate online. We have noticed in the last years, not even months, years, about the aggressivity that FFS should have or how conservative it should be. And we have put a lot of effort lately on video and a very complete blog that explains our point of view. And I wanted to do this live because it's always nice spontaneously to respond, since I have to talk many times with patients that ask me this question. And during a consultation, I always feel it's very, very clear to patients when I can explain my point of view, right? So I was looking forward to this live. And is aggressive necessarily better? No, because it all depends on what aggressive is, right? So we believe that aggressive, in my opinion, should be that you will always be able to go to the maximum with safety. So if you can identify a masculine landmark and you can eliminate it completely, you went to the maximum, you were aggressive enough. Imagine if you have, for example, a frontal bossing, and with your technique, you reduce it, but you cannot do it completely. You cannot make a very smooth transition with the nose. then this could be called a lack of aggressivity, and this could be called a negative result. So to be aggressive on a forehead, in my opinion, would be to get a complete smooth transition of the forehead. That would be aggressive because it cuts to the chase, it goes to the point. It never leaves anything that should go. But at the same time, aggressive can be considered as a term or on something that is dramatic, okay? Like, I want to have my face aggressively change. And we hear this sometimes from patients that want to have a change that is not about feminization, but about almost changing their identity or changing their face to something completely different, okay? And this is not the philosophy of feminization. In itself, feminization is to eliminate masculine features, okay? So aggressive can be better when we consider it as a concept of going to the maximum possible with safety. This would be my answer for this question.
Had my mic on silent there. So yeah, thank you for that answer, Dr. Simon. I think that was very clear, but I just want to reiterate to people who are listening now that if you have any questions, please place them into the chat here on YouTube. Yeah. So to move on from that, this in the same sort of line, does aggressive, in your opinion, mean fake or unsafe?
Not at all.
That already a little.
Not at all. Again, it's a matter of concept. But sometimes, if we consider aggressive to be, I want much more change than, let's say, advised or advisable for a feminization surgery, then yes, it could give a result that is artificial, a result that is, let's consider, not fake, but it doesn't match the age of the patient. We have seen many patients undergoing what could be called extremely aggressive FFS, that in my opinion was not FFS anymore, was already something called extreme makeover, and patients that are very young with a very operated face, so it doesn't match the age. When a face that is young has different features achieved by surgery that are not very according to their age, it's very clear. You can see it and doesn't look natural, okay? But we cannot forget the other side of it, what you just said, that yes, we should be aggressive to eliminate completely the masculine feature, but we have to be safe at the same time. Unfortunately, we have anatomic features on our bodies and our faces that needs to be respected, and we have to take care of them the whole time during surgery, from the soft tissues, the nerves, to the gums, to the mucosa, to the skin. And we have to be able to provide a procedure that after the surgery, patients can regain their normal life without thinking about it so much, you know? So we cannot do a surgery just for the aesthetic or shape result of the face. We have to deliver a procedure that gives the patient a healthy life after it, okay?
Absolutely. So to take it a little bit further, I'm gonna plant the big question here, because people for a long time have been commenting that Facialteam is too natural, too subtle, and not aggressive enough. So in the case that a patient asks for more aggressive work, is that something that could be agreed with the surgeon?
Well, yes. When we see a patient, and mainly when I have read online comments about Facialteam being conservative or having natural results, first, I believe that when someone tells Facialteam has the results are too natural, I consider that a compliment. Okay, I think that is okay. This is actually what we like. We like a result that is natural. But if we could think of these terms as something negative, maybe that the changes are not so dramatic. Maybe this is what some patients mean when they say this. I would say that, of course, we have to consider that we evaluate each patient individually, and the need of each patient varies dramatically. Some patients, they are looking for a more dramatic or more aggressive change. Some patients want less. We have patients with square jaws that will ask us to keep some squareness, for example. We have patients with a strong forehead that will ask us not to change so much their orbits because they like the way they can use makeup on their eyes. Okay, so depending on what patients will ask us, the results will differ. We, as I was telling you before, we will always be the most aggressive possible if the patient asks us for a full feminization. And we do this with safety because we do all with 3D planning. Okay, as most patients that know us and follow us online, they see the techniques that we use with 3D planning. 3D planning is for precision and safety. So Facialteam is aggressive and conservative at the same time, as I explained on our blog, because we maintain naturality, we maintain important features of the face, we maintain core identity, and we maintain important structures like nerves, blood vessels. So we can conserve important things, but be aggressive, eliminating the ones we don't like. So we want to go back to a pre-puberty situation, the maximum possible on the skull. Okay.
Just to add to this, Dr. Simon, I wanted to mention that the concepts of what is natural, what is beautiful, what is aggressive are very subjective and can differ related on culture and country, etc. So that has to be taken into account as well. I'd like to bring in Mayte here into the conversation a little bit. Talking about the perception aspect now. Mayte, in your experience speaking with Facialteam patients, do you hear concern about surgery being not aggressive enough or vice versa?
Well, I have to say that in my experience, 1 year now, more or less here in Facialteam, this is not the common thing. I mean, I don't hear patients say we are too conservative. Sorry. I mean, patients who had surgery with us. My normal day would be that a patient, when I visit them at the hospital, they are happy with what they see. I mean, the most common case is that even that they are swollen at the moment when I visit them, and they are maybe bruised. Sometimes it depends on the patient. I always ask the same question, right? Is that I ask them, have you gone to the mirror yet? Have you seen yourself? What about the experience? And I would say, well, I don't know exactly what 90-something%, but most of them say that they like what they see at the moment. And I didn't hear them complaining about us being too conservative. This is my experience now.
Yeah.
Go on.
No. Yes, we have these levels of knowledge about Facialteam or any other center. When that means that you can see us online and have a very general information about it, looking at some results, looking at some pictures, or reading something about on a forum. But most patients that get in touch with us and understand the reality of the philosophy of our work, they will understand that we are not conservative in a negative way, not at all. We are extremely aggressive against masculinity of the face. So we are really strong. Our work is really strict and strong on the masculinity of the face. What happens is that, and it is not something negative at all, I believe that some patients that are looking for results that are not natural, that are they really want something that is extreme, that maybe they don't look for us in the first place. Okay, and I don't think this is wrong, because I don't think Facialteam or any center is the center for everyone. There's millions of people in the world, and we know that there should be a match between the doctor, the center, and the patient for all types of procedures. So we try to be very clear and expose our philosophy of work and explain exactly how we do things, so that the patients that identify with us can talk to us and see and confirm if we are their team. Okay, and this is my, let's say, my wish, that patients that have an initial, more, let's say, superficial idea of our approach should talk to us to understand more if this is the reality or not. Okay.
Yeah,
absolutely.
Sorry to interrupt. I would like to add something to the conversation. Yeah. When I meet patients in their pre-op consultation, as I told you before, this is something that I find, that talking about patients, about, you know, expectations about the surgery and everything around that, they know what they come here for. They know our philosophy, as you, Dr. Simon, said. They know that, I mean, what to expect when they come here. And patients that are going to have the surgery finally with us, then they finally come here, they know what to expect. And in some cases that maybe we can see a bit high expectations is about talking with them. I mean, getting to know exactly what they expect from the FFS surgery with us, and inform them about what they could expect. So, but I mean,
exactly.
The common thing is that they know what they come here for.
Exactly, and if there are patients that have been in consultation with us watching the live, or we watch it later, and I think they can confirm that I tell probably all the patients that have a consultation with us, at least with me, that the biggest complication in FFS is not a real medical complication. It's much more an insatisfaction or dissatisfaction with the final global result when the patient didn't have right expectations. Okay, so if the patient doesn't have her expectations adjusted, this is not only fault of the patient, it's also fault of the doctor and the center. That's why we try to put all the efforts we have with doing simulations, using 3D scans, using 3D planning, showing the patient everything that's going to be done to try to adjust expectations and make everyone match the same level of expectation, us and the patient, so that the results are closer. It's never going to be exact what someone has in mind. I cannot read the patient's mind, but if they are close to that, we are happy. Okay, so adjusting expectations is very important in feminization surgery.
Absolutely. So we've spoken now about deconstructing the aggressive aspect of this debate. And I have a question here from one of our viewers, Leonora. Hello, doctor. What is your opinion of the aggressive approach to jaw and chin reshaping?
Yes, very good. So the jaw and chin surgery has mainly two limitations. The main ones, okay, we can say, okay, about how aggressive can it be. One is more obvious. I'm going to show you in a second. I will share my screen. Just a second. Tell me, Lilia, please confirm me if you can see my screen.
Yes, I can.
Good, fantastic. So if you look here, okay, you will see in the screen that we are watching a 3D planning of a jaw and chin surgery. Okay, so in this patient, let's say we want to cut what is in purple. This is our bone cut plan for this patient. What you see in red, this line in red, is the mandibular nerve. This is a nerve that everyone has, runs inside the lower jaw, and it exits the lower jaw in the chin area. And it's a sensitive nerve. So it gives sensation to the lower lip and to the chin skin, also to the lower teeth. Okay, so these are from the two things I told, the two limitations we have on being aggressive. The nerve position is one of the limitations. So when we do our cuts, the cuts should be planned like this, so that we never cut through the nerve. Okay, so we can never remove more bone than where the nerve is. Okay, this is the rule number one. Good. Let me stop sharing just a second. Okay, good. Now, there's a second limitation, which is very important as well, which is that we are not going to show after the result of the surgery. The patient will not show on the street their CT scan. Patient will show their face, and the CT scan is only showing the bone. So if we remove a lot of bone, we have to see what will happen to the soft tissues, to the skin, to the muscles, to the flesh of this area. So even if you remove a lot of bone from the jaw, there's a limit to the amount of readaptation that these soft tissues are able to get. This will depend. What is this limit? Depends on the age of the patient, elasticity of the skin. So there are so many factors that affect this. How much bone is removed, how much bone is not removed. So the trick, the art of choosing the right reduction of the jaw and chin in feminization is to find the balance between feminization, but keeping nerves intact and not causing soft tissues to have difficulty to readapt. Okay, there are techniques to help soft tissues to readapt. It's true, because even if you do the perfect cut in the jaw, removing just enough, there can be some sagging. It's not rare, it's not uncommon. So there are techniques that are done on the post-op, but there are limits, of course. We have seen patients here at Facialteam for redoing. We do almost 10 to 20% of redoings every month of our patients. So we do a lot of redoings, and we have seen enormous resections of the lower jaw that could be called very aggressive, but has no real result in the clinical aspect, but generates a lot of problems, from nerve damage to glands that are hanging because they're not supported anymore. We have glands here from deformities, asymmetries. So this is how we should think about aggressivity on the lower jaw and chin. And using jaw contour, which is our method using the 3D planning, we always want to improve, but we are at the highest level we have ever been in jaw and chin recontouring. Okay.
And just to address one more excuse me, question from our viewers, a different viewer, Hagani, thank you for your question. It's slightly related. When you talk about redoing, do you have experience removing silicone? This person is asking. Is it possible for us to remove silicone?
Yes. We normally see two types of patients with silicone problems. Okay. Some patients have silicone implants. I don't know if this patient or this person is asking about silicone in the jaw specifically, or in somewhere in the face. Okay.
Let us know, Hagani. They just say in the face.
Okay, but it's no problem, because there are two types of silicone that we can remove. One is implants. Implants are easier to remove. The problem of removing implants is that, of course, they leave some memory of their previous shape. So you have to adapt. If you have an implant on the chin, there will be some looseness on the chin. If you have an implant on the cheek, the same. But I think that she mentions more injected silicone, okay? Because this is the problem we see the most with our patients that have had injected silicone. Injected silicone is something that is less common. It's a good thing that is less common, okay, nowadays. But for some generations from the 80s, the 90s, even on the years 2000, and even now, there are places that inject silicones on patients' faces, okay? This is something that should be avoided completely. Silicone is not safe to be injected like this on the face. It can migrate, it can create deformities. And in most of the times, even let's consider that silicone doesn't create problems, is that it's not the right way to address a masculine feature. For example, we have seen many times patients that have a very strong bossing here, and the solution with silicone is to fill up the top part so that the whole forehead is round, but it's very projected. So it's the reverse way of treating a masculine aspect. So just for this reason, I think silicone should be avoided. Our experience removing silicone is not good, okay? Not good, because when silicone is injected, it is not easy to localize. It is infiltrated inside the tissues, and it's not safe to cut through the tissues looking for the silicone, because then we can damage nerves, we can damage blood vessels, we can cause necrosis. So if a patient has a silicone area that is inflamed, it's worth trying to clean it. But if it's not inflamed, generally we only remove the silicone during the surgery if it's visible. Okay.
Okay, thank you so much for that answer, Dr. Simon. And Hagani, yes, Hagani confirmed that it was injections, not implants. So you addressed the question. So it's all, just to summarize, up till now, it's all very, very complex, because we're talking about expectations, we're talking about high levels of difficulty, and balancing facial features and respecting anatomical limitations. So now let's move on to the deconstruction of the conservative concept. So there's some confusion between natural or authentic and conservative. Do you?
True. I agree. I think there's a confusion on the term conservative, mixing with naturality, authenticity, or being too subtle, right? So the surgery, I went for the surgery and I almost came out the same. Okay, this is not being conservative. So there are situations. If let's consider a patient that has a very, very big pronounced forehead. Okay, very pronounced forehead bossing. If we operate on that patient, on the before and after, if we compare, the result, of course, will not be considered conservative because we're starting from a point where there is a lot of bone to be removed. Okay, but if we start with a patient that has bossing that justifies surgery, but it's mild, it's not very strong, it just bothers her, the orbits are a bit heavy, and we do the same surgery and we get to the same final point, the same point, perfect transition with the nose, nice orbits. But if you compare before and after, then you could say, oh, they were conservative here, okay? And it's not the case. It's just that we adjust, of course, to the level of the problem. The amount of bone removed will change regarding each patient. So the aggressivity of the result normally comes when patients compare the before and after, and it depends a lot on the before. How was the before? What was the starting point? So as I said before, the conservative approach, in our opinion, is much more connected to keeping core identity. This is a pillar of ours since we began Facialteam in 2010. And this is not something I think will change because we see this is more and more what patients ask us, to keep their core identity, eliminating masculinity. Okay? This is being conservative, conserving their core identity. And the second thing, being conservative regarding their anatomical important structures, such as nerve, blood vessels, and health of the skin. Okay.
Absolutely. So I'd like to bring in Mayte here in the conversation, since we're talking about expectations and perspectives, which is a more subjective, personalized thing. Mayte, in your experience, how do you suggest addressing any dissonance between the perception of results and expectations and actual results and expectations?
Well, as I said before, I believe in this to be done before the surgery. I mean, talking with patients about expectations is such an important thing that we are doing. So sometimes we have these Skypes before the patients come to the hospital, I mean, physically to Marbella or wherever it is, I mean. And we have this focus on expectations, of course, it's so important. So yeah, my focus is to get the idea the patient has about, what the patient wants, what we can offer, etc. And yeah, sometimes work with that.
Mayte, I think it's important mentioning that I believe that it's of extreme importance to have a psychological department inside the facial feminization center. And this is something that became crucial to us. And sometimes patients believe it's just, we have psychologists just to give them some support after surgery because they're stressed or it's a difficult moment. Of course, after the surgery, the first days are not easy, but this is only part of it. So our psychological department is there as well to help patients before surgery to adjust expectations, because this is going to be very beneficial for the patients, okay? And what Mayte is saying here is very important. When she's able to help even more, like we try to do as well with the patients, like when we use simulations or explain everything, this is us, this is Facialteam, trying to put all the tools on the table to help patients have a better result, because the perception of the result is what matters at the end of the day. Okay, that's why we believe that having a psychological department is so important, and we have it for many years already, and it's actually growing now. So we believe in it a lot. Okay.
Yes, I agree. I mean, exactly. The work from the psychological department starts before the patient comes to have the surgery, but it doesn't end when the patient leaves the hospital. It continues even months or years before. I mean, we always tell the patients to contact us in case they feel like talking about anything, I mean, related to the surgery, really. Results, recovery, emotions, everything. So, and we are improving our work in that sense. We are going to do more things because we think this is really important and necessary.
Absolutely. There's always room for improvement, and that's important to us. But yeah, the psychological aspects here, I just want to point out to everybody that it's not gatekeeping. It's not about having an assessment that is going to determine whether or not your FFS can happen or not. It's about guidance and making sure that we are doing the best we can to help the patient be ready for this moment in time and understand the ramifications of that, and also develop realistic expectations of the outcomes. So let's move on to talk about things to consider. So patients can work out a balanced, personalized plan with their surgical team. And I think a lot of the reason behind why Facialteam gets criticized for being too subtle is because we are personalized. And so many of the results, as Dr. Simon has been saying, you know, we have the several consultations, various different diagnostic tools that are discussed with the patient in order to determine the plan that is exactly what the patient wants, and within a realistic framework, of course. So Dr. Simon, can you tell us why being realistic about the starting point of the patient and the ending point is so important?
Well, you mentioned another aspect of a result being considered, let's say, conservative, that I didn't mention before, but you remember, it's really a good point, that it's important everyone remembers that feminization is not one surgery. It's not, I'm doing a feminization on my face. Feminization is a discipline that contains many procedures, many that go from a hair transplant, a forehead surgery, a nose, an eyelid surgery, lip lift, chin, jaw, Adam's apple, ears, cheeks, fat transfer. So actually, part of a conservative approach is also choosing the right procedures, because some patients will need 5 to 6 procedures in their FFS, and some patients with one are completely happy already. Imagine you have a patient that has an Adam's apple that bothers her. Her face is inside feminine range in general. Her skin is already well treated. She has no facial hair. The hair is grown, and she's very bothered about the Adam's apple. And then we do just the Adam's apple surgery because the patient is happy already. She feels good about herself. And then we show, for example, her result before and after. So there's no change on the face, just the Adam's apple. Could be considered very conservative, but actually for that patient is exactly what she needed. Okay, so choosing the right procedures comes much before surgery, and it's as important as the surgery itself. It also relates to cost, it relates to recovery, and it's a big part. It's a big part, really, Lydia. I really like you remember this. And of course, when you can adjust this already, I think we are helping patients' point of view of being more realistic, because when you have less procedures, more precise, it's easier for the patient to understand what's going to happen. If you're doing too many things, and some things the patient maybe she doesn't even understand why are these things going to be done. Okay, my doctor said I should work on my jaw, chin, maybe, but I never noticed any problem there. So how can she understand what's going to happen if she never had this in their mind before? You know, so choosing the right procedures is a big part of the conservative approach. Okay, again, conservative meaning keeping core identity, eliminating masculine features, and not transforming that face in a face that looks artificial. Okay.
Absolutely. And I've just shared a couple of links in the chat.
Yeah.
And one is to a blog that I wrote ages ago on the topic actually of visible scars, but yes. The aggressive and conservative concepts are mentioned in there, and also our latest blog, which Dr. Simon wrote, and it also has a video of him talking about this. So yeah. I suggest people to read that. Okay. And so Dr. Simon, do you have any suggestions about how patients can choose the right approaches in their case? You've already touched a little bit on that, yeah. With virtual simulations, for example.
Well, in general, the main thing is that the decision of procedures for each patient should be finding a common ground between our technical point of view and patient's wishes. Okay, Most of the consultations, a patient will tell us already she's bothered about the forehead or she's bothered about the chin. And maybe I noticed something else that could improve. So I will put it also on the conversation to see if it's something that the patient is going to recognize as something important or not. So patients, they should be able to decide themselves the areas that bother their face, okay, the areas that they consider masculine. We cannot impose treatments. We cannot impose treatment combinations. We can help because we have, fortunately, the experience of seeing hundreds of patients every month. So this gives us, and to our eyes, a different type of perception that can sometimes find things the patient didn't notice. But this is the only thing we can do, help patients understand things that can be done. So choosing procedure should be done together with the patients, finding common ground.
Absolutely. So Mayte, in general terms, from your viewpoint of communication, no, because I see a lot of patients, people talking about Facialteam and in the consultations and saying, well, they recommended this, they didn't recommend this, but I really want this. And wondering, I see them wondering on social media if Facialteam will do it if they asked. So what do you think, Mayte, about communication, the doctor-patient communication?
You mean when patients want to have more things for surgery?
Right, when they're unsure.
Question, sorry.
That's okay. When the patient's unsure about what they're whether or not the plan that's been recommended is for them. So maybe Dr. Simon can jump in here and give his viewpoint, while Mayte is formulating.
I think that this can happen sometimes. I would feel frustrated if during a consultation a patient didn't feel safe enough or relaxed enough to tell me exactly everything she has in her mind. Okay, so we try to make the consultation the most relaxed environment possible so we can really be open and talk about the things we need. But it happens that sometimes we make a consultation, it's a very relaxed one, we explain everything that we think should be performed on the surgery, and after this patient leaves and sends an email to us, for example, saying, I didn't mention, but I always not happy. I'm also not happy about my ears, or I'm also not happy about my nose. This happens. Okay, of course this happens. And of course, we will take that into consideration. Generally, I will ask to talk to the patient again if possible, because I want to understand what don't you like about the area? What is that is bothering you? And we can see if it's worth doing or not. Okay, surgery, it's always it's a balance about risk and benefit. Okay, so a surgery is always an aggression to the body. This is not something that can be avoided. There's an aggression. So this aggression can be beneficial and worth it when the change, when the result is going to be delivering a good improvement in the patient's life. So sometimes a patient wants to do a surgery and the result or the change is so small or so insignificant that it's not worth the risk of the procedure, not even the cost. Okay, so yeah, it happens a lot. I think it happens with most doctors, and it's our role to re-intervene and talk again to the patient about this.
Right, and I've seen several times people saying, well, I'm spending all this money to have my FFS in order for it to be successful and be what I want. So what would you say to this, Dr. Simon?
Well, I mean, it's a fact that not only at Facialteam, but anywhere to have a correct advanced facial feminization surgery, it is expensive. But at the same time, as I told you, if we start with the point of choosing the right procedures, this can be less expensive than imagined, because this is really common now that the patient, when comes to us for a first consultation, has in her mind a big amount of procedures, and this has a lot of cost involved. And when we talk to the patient, sometimes we decrease this to 2 procedures, and they understand is exactly what they needed. So suddenly it's not expensive anymore. Okay, so I understand when a patient wants results, but again, the result doesn't depend so much on the after at Facialteam. The after is always going to be eliminating the masculine features. It depends more on the before. If you want to see a lot of change, depends on how it was before. If you are already very feminine in some areas, we cannot expect to make that area a lot of change because we're already there. Okay,
Right.
so this is I think the main point.
Do you both think that virtual simulations, which are based on photos, no, that's a tool used in the consultation, sometimes before surgery, is that helpful in helping patients see the change that will happen?
For sure. We are big fans and we follow the work of Alexandra Hamer for the last 12 years. Her website is virtualffs.co.uk. You can put it later, right? The link. And she has been doing beautiful work because she tries to make simulations with patients' pictures, but at the same time, being extremely realistic about real results of surgery. She has even been with us visiting at some point the operating rooms to see real surgery, to understand a bit more in reality the capacity of bone change we had during surgery. So it was very interesting, I think, for her. And I believe the results she can make on the simulations are very, very good and very realistic. But at the same time, it can help with the side treatments. It can help patients visualize things. But at the same time, these are pictures that are non-dynamic, right? So you are doing a picture that is with a blank expression, normally serious, looking straight like that. And the picture sometimes is working in two positions, maybe a profile and a frontal view. And FFS is done for a face that is alive. This is surgery for life. It's not surgery for pictures. So the results of FFS are much more visible when you are expressing yourself, when you're smiling, when you are laughing, when you are talking, when you are even sleeping, because the surgeries are for a face that moves, for a face that has authenticity and has personality. And the simulation should be considered, as Alexandra likes to say, more as a target of what areas, when changed, gives a benefit to my face. But we believe that the reality should be better than the simulation.
Exactly. So I have a question here in the chat, a couple questions actually. One from Serena. Thank you for your question. And she says, my biggest fear is not knowing what I'm actually going to look like and that I can recognize myself. I've had this face for so long. It's such a weird concept. And so she's worried about, a dramatic change. So I'd like to hear what you both think about that.
I also like to hear what Mayte has to say about that. From my point of view, this is extremely common. Patients will say this to us, that they want to keep their identity. They want to be able to recognize themselves. This doesn't come only from the patients. You can imagine this comes a lot from the family members as well. We have consultations with mothers, with their daughters, fathers with their daughters. And most of the times I can see in the parents' face how scared they are of the surgery, not only the surgery itself going well, but like what's going to happen to this face that has been with me in my family for so many years, So it's very important to ease the parents and ease the patients to understand that, look, feminization should be precise. You are not a canvas that the artist is going to paint and do whatever we want. No, it's a very precise procedure where we are going to eliminate the exact masculine features that have been developing after puberty in this area, this area, this area. And sometimes the simulation helps to relieve the heart of the family and patient, and to see, okay, I'm still there. It's just that aggressivity on the expression, that squareness is gone. Okay.
Yeah. Nowadays, I see patients commenting. When I had my FFS, I actually requested, particularly with the jaw and the nose. Yeah. I like my nose. It's a family characteristic, and I want to keep it. It's not a gender marker. And the same thing with like real sharp jaw. And some patients have said, I like my jaw. It's just like my mother's, and so I want to keep it.
Yeah. Yes, exactly. You can mark my words that we believe at Facialteam that in the next years, patients will have less and less procedures in their feminization, okay? And because they are going to have the procedures that are really, really causing the masculinity on the face, and areas that are considered to be common in any cis woman as well, they are not going to be touched anymore. So, and then if they are touched, it will be more for cosmetic reasons. So I think this is the new tendency, what's going to happen in the future as well with FFS.
Well, in my experience, I think patients are very aware of that. I mean, they know they are going to still look like themselves. I mean, they will be able to be recognized, but they will also be feminized. So it's the feminine version of yourself, what they are looking for and what we can offer, and what is, it's a good thing to be able to think that you are still you, right? It's for mental health also.
Yes.
Absolutely. So we have somebody in here also asking if technology will help with this, permitting patients to see, apart from the virtual simulations, which we already use, but using computer generated technology, not just Photoshop, on photographs. Is that in the works?
It's in the works.
Wow.
Facialteam works also as a research center. We are nowadays the center that has the highest amount of scientific publications in the world about FFS. And we have a lot of work going behind the curtains. One of the works we are participating right now are prototypes, which means that we are trying to understand that how can we foresee a type of skull if that skull has never been through puberty. And we are using prototypes of hundreds of skulls from different ethnicities, of course, different regions of the planet, to be able to get at some point that you see a patient's picture and you get a realistic version of the realistic feminine version of the patient. Okay, so of course, right now, the problem with Photoshop is that it's not Photoshop, is that it depends on the knowledge of the person working with the Photoshop, and it's very difficult to train. There are not many Alexandra Hamers in the world right now, and to be an Alexandra Hamer, you will need years of experience, years of understanding the procedures, the reality of it. So if at some point prototypes like this appear, I know there are some apps that are a bit funny on that you can find apps that you can feminize your face, but these apps, they are far from realistic, and we are trying to find things that are realistic for people that are going to undergo a big surgery, so we cannot depend on face app or things like that.
Exactly. So yeah, Alexandra Hamer has spent hours and hours and hours in the operating theater with our team, thousands and thousands of consultations alongside our doctors. So has a very precise perspective on what is actually possible with the surgery. So that's important to her being able to create simulations that help adjust to realistic expectations.
I think she helped in her life a lot of people, or maybe adjusting expectations, so making results much more appreciated by patients, or in many times making patients understand they don't need surgery, how helpful can be, right? How helpful this can be. And in many cases also making patients get excited about a surgery that they didn't know they even needed. So I think she has helped a lot of people.
Yeah, and also I don't know if she does it anymore, but she does have a long waiting list, and there's a fee for her services, of course. But and I'm not sure if she does it anymore. But part of her evaluation usually includes an analysis, a written analysis.
It is. I still do it. Yeah.
Yeah, and in this written analysis, it's segmented, and that brings me to the next question, actually, that this interview is based on, actually, some questions that I found that one particular person put out in Reddit, and is that, can patients get closer to defining their own needs, which is an important internal process before having the surgery, by getting the professional advice segmented by each facial feature? What do you think about that?
It's possible. At the same time, it's difficult, because when a patient wants to have a small jaw, I need to see the whole face. The face has, different than other areas of the body, it has a composition that requires proportions, that requires harmony. So feminization has always to take this into account as well. we have had many patients that went to surgeons that were not looking for a real feminization, were not specialized even in feminization, but were nose surgeons, for example. So they try to make the most feminine and small nose possible. And then the results are faces that are still masculine in general, sometimes long faces, but with a very small nose. Okay, so I mean, the nose, if you look only to the nose, it's feminine, but on the face, it doesn't look good. So we can, of course, try to separate the features. This is how we do our analysis in the clinic. We always go evaluating each third of the face, but every time considering the other areas. Okay? It's very important.
Thank you for that. Mayte, there's somebody asking here about fear, being afraid, you know, despite having the consultations and having all of the simulations and you know, the assurance. What are some things you recommend to manage having this fear and anxiety before surgery?
Okay, you mean fear about having the surgery?
Yeah, I'll read what the person actually says is, I fear negatively affecting a feature I like, such as my smile. So it's a very, they're going to have the surgery and they know that, well, the results will be positive, but there's this fear about something, you know, being affected.
Okay, something that they like,
something that they like being negatively.
You mean?
Like their smile, like the smile having
something that they already like. I mean, something that they have. They already like.
Yes.
Losing that.
Yeah.
Yes.
Okay. I always tell the patients that when they make the decision to have this surgery, they are taking risks. I mean, like everything in life, right? So this is about having the best communication with the surgeons, first thing, because no one knows exactly what is going to happen. But in terms of satisfaction of the patient, I mean, of course, we offer wonderful results, everything, but we never know the feeling afterwards. 100%. I mean, we work on that with patients, starting from expectations to supporting emotional aspects. But yeah.
One thing that it's important about this type of fear, Lilia, you mentioned, is that it's true that when you're undergoing surgery, there are some things that the surgical team can control and some things not. Okay, so for example, in feminization, there should be no change on the smile. For example, there should be no change on the smile. We are not touching nerves or muscles that affect the smile. Okay, but a patient can have the surgery and then after see her smile and notice something slightly different that we don't even notice. So it's very subjective. Okay, I think that, as Mayte said, the most important thing is that you express all your fears for your surgeon so we can understand and help you ease those concerns if possible. And if there is concerns that we cannot ease because there are concerns that we cannot control, we will explain to you, and then we have to decide together about the risks. Let me give you an example, practical example. Okay, there's a very classic surgery in feminization called the lip lift. Okay, so the lip lift is a procedure that has the goal to shorten your upper lip, right? To make your teeth being slightly more exposed. It feminizes the mouth. It feminizes a bit the balance between the thirds of the face. A face that's a bit long here, good. But the lip lift, being one of the smallest procedure and quickest and simple procedures from FFS, has one disadvantage. It leaves a scar on a visible area. Okay, it's not possible to do the lip lift with an incision that's completely hidden. There's an incision under the nose. It's small, but it's there. So we have patients that come to us with fear of having a scar. So we need to be clear that if you have a lip, for example, that is very long, there's going to be a benefit. So you expose your teeth, it's going to be nice, but there could be a scar there. So your fear is understandable and valid. We can do everything of our best to try to avoid that, but there is a risk of a scar. Okay, so that's why we need to understand each fear and make that fear more objective, so there is not a monster in the head, you know. And there are many fears. We can talk about the nerve damage when you do chin surgery. I have fear about that. I have fear of sagging. I have fear that my eyebrows will be asymmetric after surgery. So many fears that we can deal with them objectively and adjust the patient's criteria of understanding. Okay.
Thank you for that answer, Dr. Simon. And sorry, I'm just gonna put us back into gallery view. There we go. Now, I said we were gonna go for half an hour, 45 minutes, and here we are an hour later.
Yes.
So we're gonna round out our talk today.
Yes.
I just have one last question that I think is important from Tanya. She said that she has spoken with a doctor that said that he would make her look like her sister, but she's asking now, what if she doesn't want to look like her sister? What if she wants to take the feminization further? Would that be a bad thing?
It depends. What is it to take the feminization further? If the surgeon that saw her and identified the masculine feature she has, and by eliminating all of them, the surgeon believes that she will look like her sister, this is her feminization. So going further, then we are not talking about feminization anymore. We're talking about extreme makeover. Now, I don't know her sister, so maybe her sister has masculine features, which is very common. Patients come to us with pictures of their family members with, look, my mother has a square jaw as well, or my sister has some bossing, okay? So maybe this sister has some squareness or some masculinity, and the patient wants to eliminate 100%. Then she's correct, she should go further. So you see how individual it needs to be the evaluation. I can respond. I would love this patient to talk to us and show us the picture of the sister, and I could give more information, of course.
Absolutely. Thank you for trying to answer. And that also just reminded me of something that people say a lot, is that, you know, a lot of patients say we're obsessed with feminizing so much, you know, eliminating every last vestige, that sometimes we overdo it.
Yeah.
So yeah, that's something to keep in mind as well.
Exactly, I agree. It was said that I think in the future we are going to perform less and less procedures on each face. Patients are going to accept more of features that could be considered more masculine, but are actually present in millions of cis women as well. And yeah, I think this is just going to deliver more naturality in general. Okay, so yeah, I think what's going to happen.
Great. Thank you both so much for your time today. And I'd just like to say, what's your favorite thing to say when you're talking with patients? Do you have something, a takeaway message you'd like to leave with us here today?
Mayte?
Okay, I will start. As you can imagine, I say so many things during a day, right? But my favorite one is, you are finally here. This is going to happen. You cannot imagine what a magical moment it is for both of us, the patient and me. It creates a wonderful moment. Yeah, very emotional.
Oh, thank you, Mayte. That's sweet.
Fantastic.
I'm sure that.
Well, I like to. I normally like a lot the moment of a first consultation. Okay, I believe the first consultation is a very, very nice moment, because at that moment we normally feel that we are helping patients to take sometimes a bit of a mess that is in their mind about many ideas, many opinions, and I like to try to organize those ideas and create a guide map, at least for their face. You know, patients sometimes are in a long process, sometimes complex process, requiring different medical attention, from hormones, from sometimes genital surgery, hair problems, facial surgery. So if at least during our first consultation, I can help patients understand from their face at least what could be done, what ideally should be done. When I hang up a conversation online, or when a patient leaves after a consultation, I think it's a very good moment. I like it. I enjoyed it a lot.
No, thank you so much, Dr. Simon. And I just want to say thank you to all the viewers that are here today for your questions, your comments, and especially Serena, who just wrote, thank you so much for this chat. Every time I watch your videos, I feel affirmed that you're all the ones to go for. Yay, so I get to keep my job. So we'll keep putting out content for you. And as I said before, we will always make an earnest effort to include trans and non-binary voices in our conversations. And let me know if you want to join in the conversation. So yes, everybody, thank you so much. Dr. Simon, appreciate your time.
Thank you so much, Lilia. And I must tell you that, or tell the audience that is watching or will watch, that if Lilia wasn't running after us the whole day to organize these lives and to organize the blogs, there would be much less information online, you know. But it's amazing your work, Lilia. We love how you're organizing your online information. You became for a long time already the face of Facialteam, and we love that it to be like that. Yes.
Yeah. 10 years of experience.
Yes,
Wow.
yes. Just that. Yes.
And definitely a lot of I've just blanked on the word, but I really want to do everything I can to help people get the right information out there about Facialteam and about facial feminization, and along the way visibilize any other causes that we can related to the community. So thank you so much, everybody. Stay tuned for next month. Like, follow, share with your lovely friends, and remember, your health and happiness matter. Bye-bye.
Thank you.
Bye-bye.
Bye.